Okay, back issues in dogs, part two, take two. Right, let's try this again. Please let me know if you can hear me now. I've changed a few things. I've got internet issues. My system is down. I'm running from an MTN card. So I'm not sure if that's part of the issue. So the moment you see me back online, please let me know if you can hear me. Uh, okay. So if it looks like I'm in a classroom, that's because I am. I've been teaching the veterinary physio students at Equine College in Plettenberg Bay. I had to make a plan. I was going to go there and be in person, and now it's all had to happen online. So right, part two. So looking at all the comments from yesterday's talk, I can see that there have been. I mean, this is a topic which touches many people and many dogs, and unfortunately, it is something that we see more frequently than I think we really should. We've touched on the fact that it's genetic. It affects a fair number of dog breeds, and we looked at what actually causes the disease and some of the factors that vets use, what we get taught, to determine whether or not the problem is surgical, or the treatment is surgical. So I don't want to throw surgery completely out of the window. We don't want to throw the baby out with the bathwater. Hi, Jean. Please let me know if you can hear me. We had a little bit of a problem when we started. So I don't want to throw the baby out with the bathwater. Okay, there is almost a perception that vets are very eager to do surgery and don't follow other options. And I think that has to do with the way in which we are taught and the way in which we are trained. And so I spend a lot of time trying to get information out to my colleagues, or not even trying. I do get information out to my colleagues, but I would also urge you to be asking questions and looking for alternative solutions. So we ended off yesterday. Okay, perfect. Thank you, Yanni. So we ended off yesterday talking about if you have one of these breeds, there's a good chance that a back problem is going to occur somewhere in the lifespan of your dog. And I said, investigate options and have a plan of action. And so I maintain that. Have a plan of action, because when it happens, you are going to be so distressed and so emotionally traumatized. Thanks, Jean. That logical decision making is actually going to fly out the window. Okay, so if you have prepared for an eventuality, then you have your checklist and you know which vets that you're going to contact, and then you actually have a action plan that you can follow. Okay, so I don't want to spend any more time on that. I do want to look at so there's a good number of questions and a good few points that came up following yesterday's chat. So the first question came, and I can't remember all the names, so please forgive me. I don't have access to them now either. But the first question came, and it was about, this has happened once to my dog, can it happen again? And the answer is yes. And then you read a bit further and you look at some of the other comments, and some lady, her dog had back surgery. 3 weeks later, it had surgery again. I've seen a number of dogs that have had at least 3 surgeries. Usually they are a few months to a few years apart. So that intensity, 3 weeks apart, wow, it's really hard to cope with and to deal with. And the reason it will happen again is because if you remember the skeleton from yesterday, from the neck to the tail, we have 30 odd discs. And when the problem occurs, it often involves one, maybe two, sometimes three discs. So if we opt for surgery and the surgeon opens up and removes the compressive disc material, the material that's compressing the spine, then he's removing the material at that point where it is creating the compression and the trauma in that instance. But there are a whole lot of discs in front of that one, and there are a whole lot of discs behind that one. And one of the issues that happens is when you remove the disc material, there's no pain. Okay, so the pain goes, and that's the real big plus. It also means that the spine is able to regenerate and to repair. So once that happens, over the period of 6 to 8 weeks following the surgery, because we've removed the cushion between the two discs, okay, those discs now are going to fuse. So in people that have back surgery, you often heard, oh, I went for a fusion. The surgeon fused my spine. So then they will purposefully plate or do something that fuses the spine. In dogs, we don't do that. We remove the disc material, and as a result of that, those two vertebrae will fuse. Now, if you think that the disc is there for shock absorption, okay, what happens now that I have two vertebrae that are fused? Where are there another lot of vertebrae? There's another one there, and there, and there, and there's another one there, and there, and there. So what happens when the shock can't be absorbed here anymore? Okay, it dissipates along to the other discs. Okay, and if you have a breed from a genetic predisposition, all those discs are degenerated. They don't function like they should. Now we're creating more pressure. And so unfortunately, yes, you can have a disc herniation further along the spine. Okay. So once we've removed the material, then there's nothing to herniate in that point. That is my understanding. But I'm not a specialist surgeon. As we go along, we have other discs that could actually prolapse. Okay. So unfortunately, yes, it can happen again. So one of the other things that became really evident in the comments from yesterday was the total lack of preparation, physical, emotional, and mental. What happens when your dog has to have surgery? Or what happens if you opt to care for your dog conservatively, but your dog is now challenged? Okay, your dog can no longer perform functions of daily living until we get it to a point with therapy or with surgery. We get it to a point where it is actually able to walk around. It is actually able to urinate. We're not worried about cage rest anymore. The impact on a person's life is enormous. And it's something that as a profession, we don't really speak about. We just are concerned about how do we alleviate the pain and how do we get the dog back to being functional. Okay, and that's what we're taught. So we are taught that it is a matter of urgency and that the sooner we operate, the better the result. Okay, that's what we're taught. And so it becomes, what do we do? Do we talk to you first about all of the things you can expect following on, or do we actually get the dog into surgery and perform the surgery? So we are also faced with decisions and dilemmas and conflict. Okay, and that's all I'm going to say. So let's look at what happens. Okay, so for those of you that don't know, I am fostering a pug from Pug Rescue. His name is Dylan, and Dylan is compromised. When he arrived at Pug Rescue, he couldn't use his back legs, and he has been a patient at Animal Health and Hydro for about 14 or 15 months, and we've gotten to the point where he can actually use the legs. But if he gets tired, he drags the legs. He doesn't have complete bladder and bowel control, and he doesn't feel his feet so well. And so I have had to change my lifestyle to accommodate Dylan. And the reason I can do it right now is because I'm closed. I'm closed for business, and I don't have the usual crazy, busy, hectic lifestyle that is part of my day-to-day existence. And I appreciate that the vast majority of people actually do have busy lives, and we have children, and we have to get to work, and we have to travel vast distances, and many of us are away from home for more than 12 hours a day. What on earth am I going to do with my dog who is now paralyzed, compromised, can't get out to wee? I've been told that I need to keep him in a crate or a cage. There's no one there to move the dog around. I don't trust anyone to move my dog with the same care that I would move my own dog. And so all of these thoughts and dilemmas and implications and conflicts actually come into play. And looking after a physically challenged pet is not for everyone. And sometimes, if you are not able to afford the surgery, and you're not able to look after the dog, and you're not able to give the dog a quality of life, because it will take extra input from you, then there is never any judgment from me if the decision is that we're going to ask for euthanasia. Okay, the pain is immense. The pain needs to be controlled. That's the first thing we have to control, whether we're doing surgery or whether we're looking at it conservatively. Okay, so I don't want to spend too much more time on how it will impact your life. Be aware that it will impact your life, and that whatever decision you make is not one that should be made lightly. And therefore, you should be having conversations with your vets, or alternatively conversations with your veterinary physios or with your rehabilitation practitioners about what is going on. Now, in our practice, if somebody phones and says, my dog has a back issue, it's suddenly gone paralyzed, the first question we ask is, have you had it at your vet? Because we don't do any diagnostics here, and we don't have a facility to treat emergencies or pain. So the first port of call is your vet. If you've done that and you've opted, you can't afford the surgery, or you've opted to not do surgery, then my administration and my office staff are all instructed, back dogs need to be fitted in as soon as possible, so that we can assist with the process of managing the pain, and we can assist with your process as a family. But how are you going to manage this dog? What's important? What do you need to look out for? How frequently do you have to take the dog out? What are the accessories that you may need? So sometimes you need a sling to help with moving the dog. Sometimes you have to actually go out and buy a harness because your dog's not used to being on a harness, and so on. So there's a very long discussion that needs to be had based on the choices that you've made. And sometimes it can even assist. So I've had a number of people that originally said, oh no, we're not going to do surgery. They've received pain treatment for their dog. They come and see me or Dr. Marisa, and following on from that discussion, many of them have decided to take their dog for surgery. Okay, surgery often is a quick way of getting your dog back on its feet, but it still requires 6 weeks of post-operative care, and sometimes longer. And I always recommend rehabilitation so we can get that dog back to functions of daily living as quickly as possible. Okay, so the post-op care is as intense as choosing to care for your dog without the surgery. Okay, so if you opt to go for conservative care or conservative management, it requires as much input as post-surgical management. So when this happens to your dog, your life will change. Okay, so I have also decided that I'm going to be doing a number of videos on how to manage the post-op dog. They won't occur on this platform. They will be available through Animal Health and Hydro, because I really feel that there's an enormous need for this. So watch my Facebook pages, sign up to the newsletter, go to the Animal Health and Hydro website page, ahah.co.za. You can sign up for the newsletter there. Instagram, we have an account. YouTube, we have a channel. So we use all of these channels to get our information and our products out there for you. Okay, so watch the space. It is coming, but it will take about a month to get out there because there's a lot of editing that needs to happen. All right, so the other thing that came up was how do we prevent this problem? Okay, so one of the big things, and I'm only going to say this once and I'm not going to harp on it, but now that we are aware, certainly in Dachshunds, that there is a genetic predisposition, we should be screening our breeding dogs for this condition. And if they have the genes or if their offspring have developed back disease or disc disease, we should be removing those individuals from our breeding population. Okay. So there is a onus and a responsibility on ethical breeders to be looking at what contribution do their dogs make in the gene pool regarding this problem. Having said that, I think that in this country, in South Africa, and I don't know about elsewhere in the world, but I should imagine it's also a problem, we have many, many, many backyard and unregistered breeders. And what they do is the dogs are a commodity and the dogs are there to make money, okay, for them. And the less money they can spend on screening tests and on the health and care of their animals, the better, because it's more profit for them. So be very aware if you are choosing one of these breeds as a companion. Be very aware that there are genetic questions that you can ask, and I would be urging you to use a reputable breeder. And that's another debate that I don't want to get into on this topic, okay, on this platform. Okay, so number one, we can look at the genetics, prevention. Number two, you have a dog, and it's of the breed that is predisposed to back problems. So what can you do? In your home environment, avoid stairs and slippery floors. Okay, so stairs, if you think about a dog going downstairs, the spine is going to be doing this, up or downstairs. So the same applies for jumping on and off furniture. Okay, very, very big stress factor on the discs. Huge concussion, huge shock absorption that has to happen for that disc. Okay, so if you have these dogs, what we suggest is obviously put down some flooring, some mats, something which is non-slip, because you don't want their legs to slip out from underneath them and the spine to rotate. Again, that's going to create concussion on the disc. For stairs, I would advise, sometimes if the stairs are wide enough, I say get a plank and place the plank against the wall side of the stairs, so you're creating a slope as opposed to stairs. Okay, so your dog can use the gentle slope going up instead of having to jump on each step. Okay, if you've got 2 or 3 steps outside going down into your garden, it's quite useful to create a slope. The other thing with stairs and furniture is if your furniture is, say, a foot or more off the ground and your dogs are taking that in one leap up and one fly down, because usually they chase the hardy-dar or something happens, create smaller increments that they need to use by adding a ottoman or a cushion or something. So, and then teaching them to use the cushion before they get to the floor. So you break down the shock by making the height that they're jumping less. Okay, ideally, we should be picking them up onto the furniture and picking them off the furniture, taking them, lifting them. For stairs as well, baby gates work amazingly well. Okay, so if you put a baby gate at the bottom and a baby gate at the top, and let's say your kitchen is downstairs and your office is upstairs and you work from home, your dog is not running up and down those stairs all the time. So you're reducing the concussion on that disc. So when you're going upstairs to your office, pick up the dog, open the baby gate, walk up the stairs, get to the top, close the baby gate. The dog is now upstairs in your office. Okay, and the same applies when you come down. All right, so that's stairs and some ideas about slippery surfaces. And And then the other thing that I would urge you to do is to teach your dog to walk appropriately on, I prefer a harness to a collar. And we could look at, in fact, my next newsletter is on how to fit a harness appropriately, because there's lots of things to consider. But if your dog is able to walk on a lead, it means that if the problem occurs, number one, it's easier for you to manage. But number two, if the dog can walk on a lead, you can control the exercise and the rate and the speed at which your dog walks. So exercise is important, but it needs to be controlled exercise. So the ball chasing is bad for so many things. Okay, it's so bad for bucks. If you think about them hurtling down to the bottom of the garden, jumping, catching that ball, twisting, coming back down, all of those forces on the spine are enormous. Okay, so ball chasing is not a good idea. And also we're looking at cruciate injuries, so injuries in the knee. It just makes it more, your dog more susceptible. If you want to play ball, teach your dog to swim. So swimming is fantastic. Throw the ball in the pool, let your dog do the twists in the pool where the water is supporting them. So swimming and controlled swimming is also a really, really good exercise. And I see we're coming, I tell you what, there's so much in this topic. But I think those are the most important. Manage the movements and the concussions and the jumping and the stairs. Teach your dog to walk on a harness, and hydrotherapy, swimming, fantastic. What we do offer, we use a lot of inflatable equipment, so balls, discs, peanuts, physio rolls, and things like that. What we want to do, just briefly, is we want to strengthen the core. So even humans with low back pain, we always want to strengthen the core musculature. In dogs, it's no different to people. It's the muscles that run along the spine, as well as your lateral abdominal muscles and your abdominal muscles at the front. In dogs, they're the ones that are underneath. Okay, we want to create an exercise program that actually strengthens the core and engages the core. A lot of dogs inherently don't use their core muscles. Okay, so that is something that we can teach you to do. And you can probably Google it. There's 1,001 YouTube videos that could teach you how to engage and actively use your dog's core. What we are doing right now is we are actually offering home exercise programs. So we're putting them together. They come with descriptions and they also come with videos for you to start with a basic core strengthening program. Okay, so yeah, stairs, jumping, walking, swimming, core exercises. Those are the 5 basics to help you to prevent or to assist the strengthening so that the risk of a disc herniation is reduced. Okay, and then the genetics. Cool. Yo. Okay, please post a whole lot more questions. If you have more questions, there might even be a third Facebook Live coming out of this. But I think I've covered just about everything. I'll have a look at the questions and see if there's anything that still comes up. And then I'll catch you all tomorrow again at 12. Hopefully there won't be any more hiccups with my connections.